Hi, I'm Tracy Shulsinger. I'm a family nurse practitioner. I own the Healing Collective Functional Medicine. And I want to talk to you about IBS because a lot of patients get that diagnosis but don't really understand what it means or what do they need to do to feel better. So it's interesting diagnosis because it's a syndrome, and a syndrome is just a collection of symptoms. And typically the symptoms are any combination of constipation or diarrhea, abdominal pain, bloating, or gas. And having the name IBS diagnosed, it doesn't really help us get better. So we want to know what's causing it. So typical causes, SIBO is a really big one. SIBO is small intestinal bacterial overgrowth. Other organism related things can cause it too, like candida overgrowth or parasite infections as well. Also, having low digestive enzymes or low hydrochloric acid. Also, just not digesting well because of nervous system dysregulation if you're in fight or flight all the time, if you're rushing when you're eating and you're not giving your body a chance to make all the digestive nutrients it needs. So, those are some pretty common causes. And testing is super helpful to understand which of these is it. So there's testing for SIBO, which is a breath test. There's stool analysis testing, which tests for all the other things I mentioned. There's adrenal testing, which looks at your cortisol and your DHEA levels for adrenal issues. And so, sometimes people don't want to test. They just want to jump right to treatment, which we can do. And we might figure it out right away just based off of history. But what also can happen is that we may not get it right the first time, and then they spent some time and some money, and then they're kind of back to square one. So having a diagnosis based off of testing is super helpful, so we can just get right to what's going to really help somebody to feel better. If you're looking for this type of diagnostic testing, we do it all day long here at the Healing Collective, and we'll be happy to help you. So I hope that makes sense. I hope it helps, and I wish you really, really well.